the Alzheimer's Association is I work with all of the chapters in Texas to make sure that we're pulling the rope in the same direction towards the end of Alzheimer's disease and better quality of care for those living with the disease today. And that's what today is all about. It's about building a community that is better together. Thank all of you that are joining us here in person. Those that are joining us on Zoom, welcome. Thank you for being here. The Planning Committee of Outstanding Volunteers has put together a full day of education and supports. I want to make sure throughout the day while you're here that you please visit all of our vendors and exhibitors next door. We want to thank them all. I very specifically asked them not have to list them, so I was afraid I'd miss one. So they will be on the back of your program, and then they'll be on the screens in the room throughout the day during breaks as well. But thank you to those who made this conference possible. A couple of really important things. Thanks to Chapters Living for donating breakfast this morning. It is available next door. You can bring it over here, eat in the room, no problem. And then also to the Gonzaga Foundation for donating the coffee. And I will offer an extra special thank you. Thanks to Senior Planet from AARP for donating the excellent IT service. So those of you that are joining on Zoom, it's because of the great folks at Senior Planet. And Arden Courts for donating free on-site respite, which is so important for those of you that are caregiving dementia or Alzheimer's disease. As evidenced by all the news you've probably seen recently at the Alzheimer's Association International Conference, which was held in July, we are entering an era of new treatments. It's an exciting time. There's so much hope. But for those living with dementia today, the caregiver experience is real. So our goal today is to provide you with education and support and show you that we are better together as a community. We're going to hear a lot of information today. And again, thank you all for being here and for all of the support of this conference. Thanks to UT Health and the Biggs Institute for hosting us. The room is great. The space is great. We have a beautiful day outside, so hopefully it's not 110 in here. I would now like to introduce you all to our board chair for the San Antonio and South Texas chapter, Anna Flores, to introduce herself and welcome you as well.
Welcome to all of you. I am privileged to be here with such caring people. And something that I want to share is that we all share a common thread. We're all in this together, as Greg said, and we're blessed to have you here today. We're hoping that you'll take this blessing on to your families as well. The summit is for us, it's for all of us. It's not from us, but for all of you and for all of us. I'd just like to share my journey that I had. I didn't know there was an Alzheimer's Association in San Antonio and South Texas. I did this all by myself. I retired early to take care of my mom, and I loved my job. I never worked a day. I was in healthcare, and I didn't know that we existed. So it's made it my quest now to go out and volunteer, advocate, and take as many people as I can on a better journey than I have. My dad passed away, and my mom came to live with me because I didn't want her to stay at the house by herself. So we were great friends. She was my confidant, my cheerleader, everything you can think of. We had a great relationship. And periodically she would ask me, "Where's your dad?" And I would have to gently remind her that Dad was gone, but that we were all going to be together one day. And again, periodically she'd ask me that. Of course, through the course of her illness, we found out she couldn't remember many things. She'd try to talk on the remote control of the TV, thinking it was the cordless phone. And I think all of us can relate to situations like that. And I guess the main thing that I wanted to share with you was, again, the generosity of so many of my friends that would come and help me care for her. I was, when you saw my ATV, I remember you with my grocery cart. parked because I was trying to get back home to take care of my mom. But I do want to say that the hope is there for all of us. With the new research going on, with your help of donating and being advocates and volunteering, you know, we can do this. I don't want anyone to ever go through what I went through. I want it to be an easy journey for you. I used to sleep next to my mom's bed because many times she would have the sundowner syndrome. And she would call out to whoever was there and she'd say, "Is anybody here?" And I just reach over to her bed and give her that comfort. But there was one glimmer of hope that I really want to share with you. The day before my mother passed, she said, "Anna, would you do me a favor and call your dad?" I was elated. She remembered my name. She wasn't asking for me. And she remembered my dad. And I said, "What do you want me to tell him?" And she said, "Tell him I'm ready." And I knew what that meant. She said, "Call him." She had me by the hand. "Call him right now." So I pretended. I picked up the phone and I pretended to call my father. And I said, "Dad, Mom asked me to call you, and she said she was ready." And I pretended to have a conversation with him, and I said, "Okay, I'll tell her." And in her little tiny voice, she said, "What did he say?" And I said, "Mom, he said he's coming for you, and that he loves you." And she reached out her hand. She put it down. And an hour later, she was gone. She was gone. She was gone with my dad. I know my dad somehow came and picked her up and took her with him. And I was privileged to be able to have that moment with her. With my mother, because I felt his presence there. Just know that the Alzheimer's Association is here for you 24/7. All you have to do is call. We're here to serve you and to help you through this journey. The strides we're making now are really tremendous, and we want to keep you abreast of it. And I know that's why you're here today, because you care, and we care about you as well. I'm privileged to be the board chair this year. And again, I want to welcome, if we have any board members here, to please stand so they can be recognized. I think they're in the next room. And we have a tremendous team that actually put this all together. I don't know how they do it. I wouldn't be able to sleep that night. But they're here as well, so we'll ask them to stand as well. We've got some of them back here. Especially me, because I know the journey. I've seen the road. Thank you.
Told her she makes us cry this early in the morning. We're in for it. For the rest of the day, it's going to be a bad day. Actually, it's going to be a really good day. So, good morning. I'm Myron Cordes. I'm the past chair of the board and one of the board members. MC today. And so I have the privilege of introducing Councilwoman Dr. Adriana Rocha Garcia. I'm going to butcher this. And she has a 20-page vitae, so I'm not going to read it all. I highlighted a few things that I liked. She has been a lifelong resident of San Antonio. She earned a Bachelor's of Arts degree from the University of Incarnate Word, a Master's of Arts degree from the same university, her doctorate in advertising from the University of Texas. I saw your son went to Our Lady of the Lake. That's my alma mater, my master's. I was going to say, they probably have some kind of symbol. Is it wings up? I don't know. That's how long ago I graduated. I don't think we had animals back then. So, in 2020, she won the Woman of Excellence Award from the National Foundation of Women Legislators, 17 more paragraphs, President of the San Antonio Housing Foundation Trust, 2 more paragraphs, Chair of the City of San Antonio Ethics Review Board. I know I'm skipping everything. She's too young to have this many highlights. Single mom to her son Steve, who graduated from Our Lady of the Lake, and she visits her octogenarian parents daily. So a testament, and she's going to come say a few words about that. So thank you.
Hi, good morning, everyone. I'm so honored to be here with you because I am just like you. I'm a caretaker. And my dad was diagnosed with Alzheimer's last September. And so, like you all, when we learned about the diagnosis, it was hard. I didn't know exactly what to do, where to go. And by the way, I'm an only child. And so some of us are lucky that we have an extended family, like I have an extended family that includes multiple family members, but also multiple friends, family friends who want to help and care about their community. And so I want to thank you for being here today. I want to thank you for being a caretaker. And I just want to thank you for the job that sometimes you take because of your loving heart, because of your caring heart. And I just want to tell you that I had a very difficult day yesterday because as caretakers, we know that sometimes we have good days, sometimes we have bad days. So lately, my dad has a few more extra doctor's appointments because one medication has thrown another medication off, etc., right? A little bit off balance, but finally getting him there. Yesterday was his month checkup after I think we finally figured out all the medications. And I took my dad to work with me. I took him to work with me in the morning because his appointment was at 9:20 a.m. and I had a speaking engagement at 8:30 a.m. So I asked my mom on Thursday night, Mom, can you make sure that he is ready? I'm going to pick him up and I've got to head over. Downtown traffic is really, really bad, so I can't be late. So my dad was ready, but my mom must have forgotten to tell him that he was going to come to an event with me. And so he was ready to go see his doctor. He was ready in his casual dress, and it was fine. But I said, Dad, I just want to remind you, you're going to an event with me. Are you okay? Because I'm fine taking you like this. He said, no, I want to change. Let's put at least darker pants, darker jeans. So we went, we changed him, a little bit late. Traffic increased his blood pressure. He was so nervous because he doesn't drive anymore. And so downtown traffic is really, really scary if you don't drive. And so even though I was being extra careful so that he wouldn't get nervous, he was terrified of traffic. And so at that time, right, it's even scarier because there's 18-wheelers and everybody's trying to get to where they're going. Everybody's already late, it seems like. And so we get to my event. I was welcoming a delegation from Waco, business leaders. We get there 2 minutes late. He sits down, and by the way, my dad doesn't speak English, so he doesn't know really what's going on. Shake his head, smile, say hi, thank you. That's about it. And so I did my speech. We head over to the doctor. Took a little bit longer than we needed to at the doctor. So I was an hour and a half late to my next event. And I'm telling you this because I was an hour and a half late. And it was something that was very important to my staff. And they wanted to celebrate me because yesterday was my birthday. And yesterday was the first time in 45 years that my dad had forgotten my birthday. So all throughout the morning, I was trying not to rush him. I was trying to make sure he felt comfortable coming to me, coming with me to work. I was hoping that maybe he would remember that my dad never forgot anybody's birthday. And I was so I didn't want to tell them that there was a whole staff and my best friends and my son waiting to have 2 hours of my day to celebrate my birthday. I didn't want to rush them. I never told them. Dropped them off at home, and I headed over. And thank God that I have wonderful friends and a wonderful staff that is supportive and never said anything about me being an hour and a half late. And I'm so grateful to them, and I wanted to take the opportunity today to share that with you, because you have a community of support. You have a community that understands what you're going through, that knows that you have needs too, and that they can't rush you all the time because you're dropping everything that's important to you to take care of your special person. And sometimes you're taking care of more than one person. And that's why it was so important for me to be here with you today. Because even though I didn't know that was going to happen yesterday, it's happened multiple times, different things, and we stop everything we're doing. And you are doing an incredible job loving your loved ones. And I just wanted to come and say thank you for being incredible to your loved ones, for being so supportive. And I just can't thank you enough on behalf of our entire community, because there's a lot of people out there who don't have someone like you. And for those people, I ask that you pray and you support the Alzheimer's Association, because that's where they're coming in. That's where all of our partners are coming in. And it's going to take a village to continue to fight this and to support those that are going through this. So I hope that you all have a wonderful conference. I'm going to try to stick around for some of it, but I still have some other obligations, and so I'm hoping that I can find some recorded version or PowerPoint or something later where I can hear some tips. But if any of you has any tips, please let me know. And again, thank you so much for allowing me to share my story with you. I look forward to learning from one another and to support you. So thank you so much.
Thank you for sharing your story and being inspirational. So I echo what Dr. Garcia said, Rocha Garcia, that you all are supporting your loved ones in such a wonderful way. And we want to thank the Alzheimer's Association certainly for putting it together. You can find them all around, and I was going to say in purple shirts, but a lot of us are wearing purple shirts, right? So if you see a purple shirt, there's probably a really good chance that that person is with the Alzheimer's Association or even connected to the Alzheimer's Association. We're Jones over here in purple, but Kelly will get it done. So we do want to thank all of our sponsors, and so I wanted to, we want to call up some of them throughout the day. So we have the Law Office of Carol Birch. Is that right, to come up and give a 2-minute? You want to go get them? Okay, and then we have UT the Bigs, and then Emily Ortiz from ACOM. Do we have any of those folks in the room? UT Biggs Institute? Is Dr. Chicago going to speak? Emily from ACOG? Okay.
They're next door.
They're all next door. Okay. I will skip ahead for just a quick second then, and I'll talk about kind of what's in your registration packet. So you should have an agenda in your packet. That's the easy one, right? Because it's called label. It's labeled the agenda, so it hopefully is self-explanatory. You additionally have a bingo card, and so that we ask you today could not have happened, and today, thankfully it is free to you, but it's not free to put on. So we do want to thank all of our sponsors who were able to help us put this on today. So if you'll visit their booths next door and complete the bingo card to be registered for some of the door prizes, but you'll only be registered if we know who you are. So there is a back side to this, so you do have to fill out at least your name. We don't necessarily need all of the rest of the information, but we do need your name to be able to call to you. We also, there is our first speaker has a list of some drugs, and he'll explain that, sure. And then we also have a form about the ARPA grant demographic form. And so the Alzheimer's Association received some special ARPA funding, basically a special grant. Don't ask me what ARPA stands for. And so to qualify for that, we do need to try to get some demographics. Your name, address, and all of that is separated from all of the rest of the information. So we recognize that there is some sensitive information on here. So out at the Alzheimer's booth and at their table, they have some manila envelopes, so you can place this in a manila envelope and turn it in so that it is kept secret. And then they will input that data and separate it out, separate your name from the actual demographics. If you don't want to just leave it at the Alzheimer's table next door, at the vendor table, if you can't get to that quickly enough, find any of us in a purple shirt that are either board members, volunteers, or work for the Alzheimer's Association, and we will be happy to take it from you, keep it confidential, and get it into the right hands. Additionally, we have CEUs. If you are a nurse or a social worker, and in person in attendance, I know we have a lot of people online. So if you're in person, you should have picked up one of these forms out at the registration table. If you didn't, you can get one later today. We do have to verify that you stayed all day, so you can't turn it in until the end of the day. Gotcha. So there will be a black tub on that registration table, but it won't be there till the end of the day. So if we find any of these floating around on the table, or laid down, or turned in anywhere else, they will be shredded. We don't know if you were here. So you do need to turn it in that black tub at the end of the day, back at the registration table. For those folks online, we have your registration that you wanted CEUs. And so we have a list of who is attending. So you do need to stay online. We prefer that you stay in front of your computer too, and pay attention. That's really the point of it. So we will need to see the timestamps that you were here for all the sessions. If you lose connection and sign back on, it's okay. We know that we can do the math. Our Excel spreadsheet does math for us. So, okay, with that, I will call up the lovely, the talented Helen Flores from the law offices of Carol Birch.
Everyone, I see some faces from last year here as well as some new faces. Thank you for coming and sharing. We are feeding your brain today. My name is Helen Flores. I'm with the law offices of Carol Birch, and Carol is presenting later on a caregiver panel meeting, and then another attorney, Autumn Puckett, will be here from 11 to 2. So please stop by if you have some legal questions or you want to talk about what happened with your personal scenario. We'd be happy to do so. But Carol is a huge advocate for the Alzheimer's Association, and so we feel like not only are we educating you today, but we're feeding your minds. So lunch, your box lunch is covered by the law offices of Carol Birch, and thank you for the opportunity.
Okay, and next we have the UT Health Science Center, San Antonio Biggs Institute. I don't know if we have anybody going to speak from that.
To the caregiver,
Far side of the room. There we go. Awesome. Dr. Delgado. I was so close.
Good morning. It's so nice to see all of you. So many caregivers in one room. I know what it takes to be here today, so we don't take it for granted. Thank you for being here. Thank you, the Alzheimer's Association, for the magnificent job they're doing to care for those that are, living with dementia and their family members. So my name is Dr. Roxana Delgado. I'm the director for the Caregiver program at the university, the School of Nursing. We work very much in collaboration with the Biggs Institute, and we provide different services. Thank you so much for all that you do. If you go to our website, you're going to be able to see some of the programming that we have. We have support groups, we have different events and different services to be able to equip the caregiver so you can do what you need to do at home, but also having the support of those who understand what you're going through. So thank you so much. I just want to share one more detail. All of us, 100% of our team have been caregivers. I was a caregiver myself to my husband. He's a combat wounded veteran. He was wounded in Iraq, and he went through 3 years of full-time caregiving. That is what shifted my entire career. Since 2010, I have been dedicating my life, my professional life, to make sure that caregivers have a better quality of life while they do their caregiving. So thank you so much for this opportunity, and thank you so much for selecting me today.
Our partnership with the Caring for the Caregiver programs we go a lot, but back to for providing this wonderful space. I mean, this is fantastic that we're able to meet in this wonderful. So, and then next, Emily Ortiz with ACOG, the area agency. Oh my gosh.
Good morning, everyone. I hope everybody enjoyed their breakfast this morning. My name is Emily Ortiz, and I'm the outreach specialist with the Alamo Area Council of Governments. We organize, that's a lot to say, we go by ACOG for short. We oversee the Area Agency on Aging for both Bear and Alamo. We cover as far north as Gillespie County, as far south as McMullen County, as far east as Guadalupe County, and as far west as Medina County. We assist those that are 60 and older to navigate their Medicare services. We assist with navigating legal services, and we help our caregivers. You can't pour tea from an empty pot, and we want to ensure that our caregivers are taking care of themselves so they can provide the best care possible to their loved ones. We do that by working with several partners, including the Caregiver Coalition, to ensure that our caregivers have access to mental health resources, to training, because nobody really trains us to be a caregiver, especially when that time comes unexpectedly. We assist our caregivers by helping them out with short-term respite for a few hours so they can go tend to appointments, go do something so they can relieve themselves and shop, do something for them. We also have other programs available to assist with utilities. We help out with appliance replacement. We can replace your fridge. If you catch it, because it stops running, we can go in and put a new one. Enough to get the job done, not enough to impress Gordon Ramsay. We also help out our veterans through the Alamo Veterans Network. We partner with about 280 different agencies for our Veterans Network alone. They work as a referral service, so you can call them. They assist with about 21 different areas, from entrepreneurship to emergency housing. We want to take care of our veterans, active duty, retired, reserved, and their immediate families, regardless of discharge status, regardless of age, and regardless if the veteran is still with us, because those families sacrifice. We also have a weatherization program aimed to assist our low-income families in 12 of our counties, every county that we serve with the exception of McMullen County. We want to ensure that their homes are insulated. It's 100 and something degrees outside today. We want to make sure that that cold air stays inside and those families are protected from this heat and from the extreme cold that we've seen in recent years. We do that by vetting them, ensuring that they are not able to afford those weatherization measures. We assist with providing that insulation and sealing their doors so that way that cold air stays in, especially during this time of year. And that concludes my services. If you have any questions, please feel free to reach out to me. My email address is eortiz, and that's spelled E as in Emily, ORTIZ @aacog.com. Thank you all for y'all's time.
For their sponsorship today. I'm not sure why you guys call it ACOG, because the two A's phonetically should be ah. And then you get to say it Anyway, my quick question came in online, how do they track their CPUs? I'm sorry if that wasn't clear. You don't. Zoom will track it for you. You need to do nothing but sit back and watch. So just stay online. And same with you all, except you get to be fed here locally. So, and with that, I get the pleasure of introducing our first speaker, and that is Robert Pistocki. I'd like to say it right, Pistocki. With a name like Byron, I should be very cognizant of his name. So, Robert, I can say that. Robert studied biology and chemistry at UTHSA. I failed chemistry. He used it as a tutor. PharmD, he received his PharmD from Midwestern University, near Chicago, right? Was it in Chicago? Oh, Glendale, Arizona. Oh, well then it truly is Midwestern. All right. Deeply committed to evidence-based medicine, Robert continuously integrates the latest research and clinical guidelines into his practice, ensuring that patients receive the most effective and current treatment. And he is currently working as a director of pharmacy for Walgreens, I believe. Is that right? I forgot to write that part down. And he joined one of our meetings. It was great to meet you at that too. I can tell your passion. So now he gets to share with you. So with that, all of you, you've got your own microphone. Right, Robert.
Good morning. Can everyone hear me?
Good morning. Talk loud.
Good morning. Do I need to talk louder?
Yes.
There. All right. Good morning. My name is Dr. Robert Pistoki. I'm a community-based pharmacist who manages a Walgreens pharmacy in New Braunfels, Texas. In New Braunfels, like San Antonio, it's a fast-growing geriatric population, which increases as time passes. Naturally, many of my patients suffer from Alzheimer's and dementia. Regularly, I interact with these patients, their families, and their caregivers, providing counseling and medication management. This population in particular holds a special place in my heart, having had many family members who suffer from this disease. My grandparents from both sides of the family, my wife's grandparents, and the grandparents of nearly all my friends. The disease is so familiar, yet so misunderstood. Getting effective treatment from the underlying issue that causes this disease and costs less than a mortgage on a house is not possible at this time. Someday we can overcome this hurdle by advocating for accessible health care for all. Pharmaceutical companies should be producing treatments for the masses, not rich elites. Speaking of affordable health care, my pharmacy offers many services, including dispensing, counseling, and routine vaccinations. But my most influential service is providing comprehensive medication reviews, what I like to call CMRs. So what happens during a CMR? A pharmacist scrutinizes every medication's efficacy, safety, and appropriateness, whether prescription, over-the-counter, or supplement. This highly individualized service can result in removing unnecessary or harmful therapies, or even bring to light untreated conditions. These clinical judgments are then documented and sent to a patient's provider for review. Most importantly, patients and/or caregivers leave educated on the purpose of every medication, which gives them the power to make well-informed health decisions. Getting patients and families involved in their own health care can vastly improve health outcomes, and that's what I aim to do here. Before I dive into what I specifically look for during CMRs, let's review what makes geriatric patients unique. Geriatric patients, due to changes in physiology, are more sensitive to medications. Kidney function naturally is going to wane as we age, which may lead to more medication building up inside our system, which can lead to increased risk of side effects from medications that we take. A simple approach is to lower the dose of these medications to their lowest effective dose, or to switch them with a safer alternative, or remove them completely if the benefit does not outweigh the risk. So what do I look for during a CMR? I follow what are called MERS criteria, which is a list of medications that can increase fall risk, lead to unwanted side effects, and can be potentially dangerous for geriatric patients. What I like to tell people is that a broken hip or a fractured hip drastically increases mortality. I don't like when people fall. Specifically in patients with Alzheimer's dementia, I also target medications and supplements that may worsen their symptoms or counteract the effectiveness of their medications. So what are these culprit medications? Any medication with anticholinergic properties will negatively affect the central nervous system, namely our brain function. I have a list of medications on that pamphlet that I gave y'all. I have antipsychotics, antidepressants, benzodiazepines, muscle relaxers, and select antihistamines. These are the culprits that I look for during CMRs. So let's dive into these categories. Antihistamines. What are safe? What are unsafe? Or what I like to call safer? First generation antihistamines are regarded as unsafe medications due to their strong anticholinergic characteristics. Common examples are diphenhydramine or Benadryl. That is the one medication that people come to pharmacy looking for, and I personally do not like it. I took it one night, got in the middle of the night to go to the bathroom, and I was stumbling like a drunk and almost fell over on my face. And I am 29 years old, so I can only imagine what it can do to someone who is older than me. Other first generation antihistamines would be promethazine. You find that in cough syrup. Doxylamine, that is a sleep aid that is commonly used over the counter. I personally don't like that one as well in my geriatric patients or patients with Alzheimer's and dementia. My safer alternatives that I recommend would be Claritin, Allegra, and Xylitol. There is Zyrtec over the counter, but Zyrtec tends to be more sedating than the other medications that I prefer. Claritin and Allegra and Xylitol, these are regarded as safer because they're less likely to contribute to fall risk and worsen Alzheimer's and dementia symptoms because they're specifically tailored to attack receptors for allergy control. Whereas the first generation antihistamines are what I like to call dirty, for the fact that they are not specific and they also attack our motor system, which would basically lead to falls, and our central nervous system, so our brain. Next, I have antidepressants. These are powerful medications that I actually do not recommend to be discontinued because they're powerful mood enhancers and stress relievers. However, there are some that I deem less desirable than others in patients with Alzheimer's and dementia. I do not recommend using select SSRIs like paroxetine or mirtazapine. I do see mirtazapine used quite a bit in our geriatric patients. We can use it for sleep and to increase appetite. But one of the main issues with it is that it can increase fall risk and lessen cognition. Same with paroxetine, because they're very sedating compared to the others. Instead, I recommend sertraline, fluoxetine, everything there, like escitalopram, citalopram, and SNRIs for people who do not have high blood pressure. So that'd be duloxetine and venlafaxine. I recommend those if you need more activating characteristics rather than sedating. So they'll activate our brain rather than sedate it. There are tricyclic antidepressants that I see used. I do not recommend these because of their strong anticholinergic properties. Examples would be amitriptyline, nortriptyline, and doxycycline. These medications are commonly used as sleep aids pain controllers account for mood. Muscle relaxers. These medications are supposed to be used sparingly. In clinical practice, these are used as add-on medications for pain control. Due to their strong anti-pulmonary properties, I also do not recommend these medications to be used in patients with Alzheimer's and dementia. They increase fall risk, they worsen dementia, and they counteract many Alzheimer's and dementia medications, like donepezil, rivastigmine, and amantine. These are more dangerous than antihistamines because they strongly suppress our brain function and increase fall risk because they relax our muscles. Antipsychotics. These medications should not be used in patients with Alzheimer's and dementia unless they're being used to treat actual psychiatric conditions such as schizophrenia or bipolar disorder. Using these medications for irritability is inappropriate and potentially harmful. Studies have shown that geriatric patients who take antipsychotics are at increased risk for death. I recommend non-pharmacological strategies before initiating these medications, like counseling, life enrichment, socialization, and other forms of cognitive behavioral therapy. These medications are so serious that the U.S. Omnibus Reconciliation Act of 1990 regulates their use in long-term care facilities. Like muscle relaxers, these medications increase fall risk and counteract brain function. At high doses, these medications can cause reduced initiation of movement, which is also called lowering of gait, where you can't initiate the movements, so you have issues getting up from your seat, you get issues initiating just walking across the room. And doing so leads to tripping and falling. The most appropriate use of antipsychotics, we use them for agitation as needed medications and should be used as such. So not taking them every day on the hour, using them for really specific situations. A European Academy guideline for agitation and dementia states, however, antipsychotics may be used as a first-line pharmacological treatment in agitation and aggression. How is this? All right. Okay. Yeah. You need to start over? Sure, you want to listen to me talk all day. Antipsychotics confer modest benefits for short-term treatment of aggression, agitation, and dementia. But these benefits have to be balanced against the risk of adverse events, including increased mortality, which means death. We also have benzodiazepines that are used for agitation. Common examples would be alprazolam, clonazepam, diazepam. These medications are used for anxiety, agitation, and as sleep aids. Like antipsychotics, their use in long-term care facilities is also regulated under over 90, the Omnibus Budget Reconciliation Act. They increase fall risk and reduce cognition as well. Out of all of them, I recommend alprazolam because it has a lower half-life, which means it stays in a person's system for a shorter period of time. There are medications like lorazepam that stay in our system for very long periods of time. So what do I recommend for agitation control in Alzheimer's dementia before resulting to medication? First, let's produce a safe, social, and mind-engaging environment for patients with Alzheimer's dementia. Safety can be as simple as removing tripping hazards and installing handrails around the house. We can also do so by labeling various objects and locations. This can help ground a person in their environment and make them feel more comfortable. Socialization means having engaging and meaningful conversations with our patients. So no small talk, real talk. Mind-engaging environments are also created through music and art, whether it's displaying art, playing music, or actually engaging with the mediums by drawing or making music. Doing these things can have a very positive impact on a person's mood. Lastly, if these methods are insufficient, it is appropriate to resort to pharmacotherapy. So medications like alprazolam and haloperidol are actually my most recommended medications, as long as the benefit outweighs the risks. So if our patient is continuously having falls, I wouldn't recommend those medications. It's just unsafe. And like I said before, a broken or fractured hip drastically increases mortality. Herbs and supplements. I do not recommend the use of any supplements for the use of Alzheimer's dementia. One of the most looked for supplements in my pharmacy is named Prevagen. It is so popular that it is behind a locked case. This supplement does not have enough evidence to conclude that it is beneficial in Alzheimer's dementia. Another supplement people ask me about is huperzine A. This supplement is supposed to closely mimic the properties of a real medication called donepezil. I do not recommend the supplement because it has yet to be studied rigorously enough for efficacy, like all other supplements. Legally, supplements are regulated as food products, not as medication. In contrast, medications must undergo rigorous studies to test for safety, which is often not done in supplement studies. And in medication studies, we test for efficacy, which means, does it actually work? And supplement studies typically do not have enough people to test for to determine whether or not they work. A given supplement study may have 50 people, whereas an actual medication study may have 500 to thousands of people in it. So it has way more power to tell us whether or not something works. Another point to consider is that with medications, we know their mechanisms. We know how they work. We know their benefits because they've been proven. And we also know their risks because the studies test for the risks and they bring them to light, unlike supplement studies. They tend to leave the risks out. With supplements, I cannot guarantee anything. And when I can't guarantee benefit, all that is left is risk. So, pharmacists are not here to undermine physicians. We often collaborate with our physicians to get you the best medical care you deserve. We are also here to get you involved in your health journey. And the best way to get involved is by getting educated to make well-informed health decisions. Pharmacists can be the most accessible healthcare provider. You don't need to pay a copay to see us. You may see us run around the pharmacy stressed out beyond belief. But don't let this prevent you from asking important questions, or even unimportant questions. That's fine. I welcome them. We're capable and more than happy to share our knowledge with you. We can be your go-to health advocate. We can advocate for you. We can talk to your provider for you. If you feel like there's a medication that you need, I can personally talk to your healthcare provider. That's not uncommon for a pharmacist to do. Dispensing medications is only a fraction of what we're capable of. So caregivers, family members, and curious people, please feel free to walk up to the pharmacy counter and request medical guidance. Okay, that's it. Now opens up the time for question and answer. You can ask me questions, I'll answer them to the best of my ability. If I cannot answer your question fully, what I'll do is I will get your contact info, and I'll look up the evidence and find that answer for you. And then after the Q&A, I would also like to give the option to go around to different tables and talk to people on the medications that they link to. If you feel like you benefit from it, just let me know. I can give you your own little comprehensive medication. Okay?
Real quick, I have the microphones. I just want to really drive home that use your pharmacist. I don't know that Robert really pegged that too hard. You can't get a hold of your doctor many times, right? It can take months to get in. He can call and the doctor will answer the phone call. And he studied drugs, your doctor didn't. So he knows your drugs. Sorry, I'm just going to plug pharmacists are fantastic.
Short-term memory. I have Alzheimer's. I have been fighting Alzheimer's for a number of years. And I had some questions to answer, but once things happen, I don't always remember what I wanted to say, but I think that in your case is talk about it, and I had a good question.
I can come right back to you, or you can take a minute. Want me to come back to you?
Yes.
Okay.
I really had a question, but I don't think
I interrupted you, and I'm sorry. So.
I had fighting Alzheimer's quite a number of years, and my memory is just going off a little bit every day. And so I'm sorry.
Don't apologize for it.
But that if I remember it, I'll just raise my hand.
Okay.
All right, we have another question over
You
here.
can always write down the question up here as well.
Hi, thanks. I'm curious, your thoughts on melatonin?
I think use sparingly. I think it's good. Now, it is a hormone, so if you take a lot of melatonin on a regular basis, your body's going to stop producing it. You're going to rely on it. So, typically what you can buy over the counter, it's like 5, 10 milligram gummies, tablets, whatever. The lowest effective dose and what they've actually studied is actually 2 to 3 milligrams. So you're kind of overdoing it if you're going above that. So if you are going to use melatonin, I typically say 3 milligrams is the max. And if you have been using high doses, try to whittle it down to 3.
I think what I think commonly is writing my mom has almost energy. It has helped kind of calm.
Yeah, it is.
I do it sporadically though.
Yeah, no, I regard it as safe. Yeah.
We have a question here too, but we also have a question online. Can you address What medications are safe? I think it's going to be a short answer. What medications are safe to crush for pig tooth feeding? That's a big question.
So any medication that is not extended release, if it says ER, you're going to end up, so ER medications, they're supposed to slowly release the medication in your system over time at a safe level. If you break open or crush an extended release tablet, it's going to dump everything at once and overdose. So generally, ER tablets are the ones that are not safe. But if you have a specific medication, I can always check that out.
Okay, thank you. Any question right here?
You mentioned in your presentation about no small talk, real talk. Could you elaborate a little? Because I think I'm small talking with my dad, but if I real talk, he doesn't understand these things. You know, so I talk about the weather, I talk about things that he might be able to understand.
That's kind of really hard.
They give him melatonin like at night to go to sleep, and I notice he's a little different, so real talk's a hard thing.
One of our sessions this afternoon is actually going to be by a panel of caregivers. I see Rudy over there. And Chris on that too.
Oh,
I didn't steal any thunder in that.
Oh, no, I think we're professional. Honestly. It's hard because when I was talking with my grandmother, she would always ask me to go out and buy her a pack of cigarettes and give me like 50 cents, I try to have conversations with her, but it is hard, and I understand that. I think the best I did was try to have a conversation, find a common ground. My grandma was talking politics. And, we love talking about who the president was of whatever time she was. So then I would ask her what she thought about Mr. President at that time. What policies do you like? Stuff like that. My grandfather, he loved fishing, and we talk about different types of catfish and perches and stuff. So I understand it's really hard, and I can't imagine going through it.
Question right over here.
My question is, should one, and if so, how should one use cranberry supplements to balance the pH in urine? Particularly when you have a folic use.
Yeah, so you can use the supplements, or what you can do is use, there's concentrated cranberry juice. That tends to acidify the urine a lot better than over-the-counter supplements. If you just get normal cranberry juice, it's typically not strong enough. Although we do have a new azo medication out there that has methylamine in it, which actually is a real antibiotic that'll help prevent urinary tract infections.
Can you, there was a question online, can you discuss Nuplazid? Nuplazid, N-U-P-L-I-Z? A-Z-I-D. A-Z-I-D.
Oh, that was it?
Sure.
How's that?
Hold on.
I'm just gonna hold it.
There you go.
What was the medication called again?
No plasma.
Relaxing. Let's see if I can read it.
Okay, so if whoever posted that, if they could check this, their spelling. The other question online was, can you address the CBD as a supplement?
Please talk to me before you review the CBD because it affects almost all medications and it can make you overdose on them. So talk to your pharmacist. They need to run a detailed list of all your medications. We need to run like an analysis just to make sure CBD isn't going to make you overdose on something by accident.
Yeah.
Yeah.
Okay.
That would go with TSH as well.
What, the THC, yes. Yeah, same.
Okay.
Thank you for taking my question. My question is using levothyroxine for hypothyroidism for a long period of time, does it affect your memory?
I haven't seen any studies that would suggest so. If you do not treat hypothyroidism, so if you're not taking your thyroid supplements, your cognition will lower though. And you'll get foggy and lethargic. So I would say it's more beneficial to take thyroid supplements, or not supplements, medications. And this gentleman right here had a question.
We got one right
Okay.
I couldn't hear back here. The muscle relaxers, did you say to take them or not to take them? Did you advise to take them or not? We couldn't hear.
I recommend taking them sparingly or staying away from them completely. Most studies have shown that they will help with pain management for about a week, and then their effectiveness wanes after that. So what I would do is use them very sparingly for extreme pain that is intolerable.
Thank you.
Okay, and I have a question here. Yeah.
I have heard recently that multivitamins are a no-no.
Yeah, so I only recommend multivitamins if you actually have a dietary insufficiency. So if your doctor said, hey, you're low in vitamin D, then I would say take vitamin D. But if you're not low in anything and you have a well-balanced diet, I don't see a reason to take any vitamins. And then this gentleman right here too.
Well, actually, so we got a little cue language. I promise we'll come in here.
Hi, good morning. I'm wondering how you feel about montelukast sodium, basically a singular, when your grandmother takes that, and a probiotic.
Okay, yeah, so as far as probiotics, I recommend probiotics that have the most different types of microorganisms in it. If you're taking a probiotic that only has one microorganism, it's not going to be as effective as one that has multiple. So I typically recommend one that has 10 or more. And then as far as montelukast, that's a good medication for like asthma and allergies. Some people though, it can cause them to get pretty moody. So it just depends. I take it and I don't think I'm moody. My wife thinks that is something to keep an eye out for if you feel like someone's mood is getting worse or they're getting depressed.
Yeah, I was gonna say, when you say moody, can you define?
Yeah, depressed, agitated, that's typically what I look out for with montelukast. It affects a small percentage of people like that. it's something just to look out for. So if you feel like it might be happening, you can try a drug holiday, is what I call it. Try to stop it for a month and see what happens. If mood gets better, then it might have been a culprit.
All right, we got one other question over here. What do you recommend for incontinence that wouldn't affect your organs as much? Severe incontinence,
Like urinary incontinence?
yes.
There is my metric.
Insurance can pay for it.
Yeah, what insurance is gonna pay for, of course. Right.
If you have a supplement, it's like, oh.
Yeah. That's a hard one. Well, insurance I've seen lately has been covering mirabegron or mymetric lately, or Gentessa, if you've heard of that.
Gentessa insurance, the code is like $400.
Yeah, $400.
It's
Yeah.
die They have to, it says you
That's
have to-
generally the safer.
Yeah, there's no generic on that one. And
Yeah.
they said you have to wait 7 years.
Yeah.
So what the other two you?
Mirabegron, mymetric, MY. B. Need to write it down.
That's okay, I'll get back to you.
Yeah.
Okay, over here. Yes, thank you. Could you talk to some of the new medications that are approved by the FDA for Alzheimer's?
Yeah, so we have Aduhelm and Leqembi. Aduhelm is actually off the market now. We have Leqembi. Yeah.
Related
Oh, good. What?
about new medication, Rexulti, R-E-X-U-L-T-I, Brexit,
Oh yeah, Brexiprazole.
Brexiprazole.
I like that one. It's a good one. I'll get to that in a second. So we have Leqembi and Aduhelm. Well, Aduhelm's no more. That was $50,000 a year and not covered by insurance. Now we have Leqembi, which is another medication that's supposed to help with early cognitive decline. It's supposed to help actually attack the underlying issue of Alzheimer's. But like I said, it's like the same price as like a mortgage on a house right now. It's like $2,000 a month out of pocket. I wish that insurance companies would cover it. That was just something that we have to advocate for, unfortunately.
And we do have the advocacy arm of the Alzheimer's Association, the plug, so check them out at the table. Okay?
All right, I have a question over here. Could you talk a little bit about Seroquel? Because that's highly used, I find, in patients to calm them down. Can you just talk a little bit about, like, what you, I know there's a lot of side effects, but sometimes patients have to have it, and I just wanted to get your feel on that.
Right. And I see it used for sleep, I see it used for agitation. One of the issues I do see with it is that it has really, like, in comparison to the other antipsychotics, it tends to be very sedating, and it leads to more falls than the others. I generally like Abilify. If you ever heard of Abilify, Risperidone, aripiprazole, those medications tend to be less sedating, just because of the receptors that they attack. Seroquel leads to a lot of weight gain, sedation, also what we call QTC prolongation, which is where it can affect the heart. So I generally don't recommend that one. But if it's needed, I get it, it's needed. Use as low a dose as possible with Seroquel.
Question right here.
I'd like to go back to the CBD. I couldn't hear you very well. And what you said, The main question that I have is, you see CBD ads all over the place, and they promise to cure a lot of stuff. Now, for the CBD, also, you find that these, in a parking lot, have a little kiosk,
Right.
like selling that stuff. And, you know, I'm sure that they probably, if like reputable organizations or businesses, they probably put out a product. And first of all, I'd like to go back to the question of what the opinion is about CBD. Secondly, are they really, the CBD, is it formulated for different types of ailments?
I see. Yeah. So it is interesting whenever I look at these products, because they'll say treats anxiety, treats cognition, or depression. Those are actually health claims that they're making. And as a supplement, it's illegal for them to do that. Of course, the FDA isn't going to do anything about it because they're not funded well enough. So they're going to continue to advertise it like that, but just know it's not legal for them to do that because you can't make any health claims unless they're approved. And like I was saying before, I recommend that if you do want to take CBD, talk to your pharmacist first and just make sure we can look at all your other medications because it does interact with a lot. One of the only true medical uses for CBD right now is epilepsy. And you would think that CBD itself treats epilepsy, but what it does is it actually prevents your body from breaking down your seizure medications. So then my question is it better just to take more of your seizure medication or to take CBD to make your seizure medication stronger? You know, so CBD by itself right now has no true medical use yet. We're still studying that.
So you're saying don't take medical advice from anything that has an on-off switch. Talk to your provider, right? Talk to your provider.
Yeah.
All right, we got a question over here. We got about 10 minutes before our next session.
Wow.
What can you tell me about lorazepam?
Lorazepam, I see that used for anxiety and sleep. I typically don't recommend it. I recommend alprazolam more, just because alprazolam stays in your system less for a lower period of time. So it has less issues with fall risk, whereas lorazepam, because when you take it, I think its half-life is 24 hours, which means when you take one pill and it's in your system, after 24 hours, half of it is out of your system. So you still have a good amount in your system left over after you take that tablet. And you gotta think, every time you're taking it, it's building and building and building on top of itself. Whereas alprazolam, its half-life's a lot lower, so every time you're taking it, it might burn you up, but your body will get rid of it. You can take another time, your body will get rid of it a little bit.
Can you spell that?
Alprazolam, A-L-P.
It's on the list.
Oh, yeah.
Okay, we have a question over here, and then there's one right here.
Yes, my mother was just recently prescribed Dementia, and the doctor had said that we're going to try it, but it only works like in 1 in 10 people. Well, this thing is unbelievable. It's amazing. My mother is in the morning, she's back to normal, but then again, the half-life starts to kind of go down I mean, I'm just impressed with this medication. It's the best thing out there. However, my question is, when is the best time to give it to her? Because I was told to give it to her in the evening, so that, because it does make you sleepy, I assume. I know we're not supposed to crush it because it is an extended release. The bottle says XR. So again, when would be the best time for me to give my mom this medication? Because when she wakes up in the morning, you wouldn't even tell her my mom has Alzheimer's.
Oh, that's good. I do like memantine. At first I was going to say you take it twice a day if it was an instant release, but if you're on extended release, it just depends on what the doctor wants. You can take it in the morning or you can take it in the evening. Do you know what dose she's at, like 27?
It's 10.
10, yeah. Memantine.
Could you spell that, please?
MENT. ANTINE.
I remember it as planetoid.
Yeah.
I read it as planetoid.
It's also called Namenda, Name-enda.
And I've talked to other people, and they say, oh, my mom's been on it for months and it didn't do anything. Well, my mom, in less than 3 days, she's herself.
Yeah, and if you feel like it's waning, you can get the doctor to increase the dosage. I think they go up to 27 milligram ER tablets.
So, of course, you're going to have some patients, clients that don't want to take medications and they want to take supplements. What supplements do you recommend?
Supplements for what ailments? Like anything? I typically don't recommend any supplements just because, as far as evidence-based medicine goes, I don't recommend anything that I don't know what its risks are or its benefit. And typically I know more risks about supplements rather than their benefits. So I don't recommend supplements at all.
Okay.
Hi, so my question was kind of addressed already. It was about the Seroquel. My mom was recently admitted to the hospital, and because at night she was, I guess, basically screaming out when my dad would leave, like, where's Mario, where's Mario? I'm going to call the police, I want to go home. They put her on 25 milligrams of Seroquel, which I know is a very low dose. Coming out of the medical field after a very, very long time and still in, an antipsychotic was just very frightening and terrifying to me. So she was on the Seroquel, and what happened was our neurologist was very adamant about not giving her certain medications for sleep because they would speed up that cognitive issue, right? So this neurologist comes to the hospital and puts her on Seroquel, and I'm thinking, no, our doctor said, no, you don't want to, do anything that's going to hurt her. So with her being on Seroquel for a few days, maybe 4 or 5, I really felt it was causing more agitation, even though it was a very low dose. So now she is in a rehab, like a SNF, a skilled nursing center, and immediately, what she mentioned earlier, said thank you for that. They took her off of that because they're not allowed to use that, I guess, in long-term care facilities. So I did get earlier that you mentioned Abilify. Is there anything else that you would recommend that would help? I stay with her every night. I stay with her at the hospital, and I stay with her at the SNF. But when my dad leaves, and she's like, where is Mario? Is there anything that you would recommend? Like Abilify, any additional? Her family doctor said she could start on the 3 milligrams of melatonin. We never got a chance to do that because she was hospitalized like the next day. So I just want something that's safe and not scary. So. And then also, one other question, she suffers with current UTIs. They recently started her on the cranberry pills, so I was glad to hear they're safe. What about aloe vera pills as well?
Aloe vera as in like the plant? Yeah.
Whole food,
foods, or they're just pills like a cranberry pill, but they're aloe vera pills that the neurologist recommended.
Okay. I don't see anything wrong with aloe vera. That should be fine. As far as medications for her, I think the melatonin, the 3 milligrams would be fine to start off with. If she is having like really bad agitation and she's like becoming a danger to herself or others, then I would typically recommend an antipsychotic. What I do like about Abilify is that it comes in 2 milligram tablets, which is very small. That's generally what I recommend for an antipsychotic. Of course.
All right, we have time for one last question, and Robert, after this, are they able to come and talk to you during the break as well?
Yeah, totally.
Okay, so if you did not get your question answered, see him after our last question.
Hi, my father was just hospitalized. He fell out of bed, so packed a bigger carpet than you think, all the way to the doctor. But we really like to be very nice to nurses all the time. However, in the hospital, we like to give the medicines twice a day. So I was just wondering, when you've got an established schedule that's worked, we all know how important all the pills are. I think my dad takes like 26 in a series over 5 moments of time. Should we push really hard to have the exact time for all the medicines? Like pretty much everything on the list, right? We've got Depakote and Geriatrics and indigestion and all the things. Does the hour precisely matter, or is it night and day? Like, how hard should we push when we're in the hospital for an event to be consistent with the home schedule, which usually has 5, 6, 7 times a day? When the nurses are obviously, overworked and tired. But how much does it matter when they receive their antipsychotics, when they receive the anti-seizure medications, those things?
I see, yeah. So it typically depends on the medication, but what I like to group it as is morning, afternoon, evening, bedtime. Those are going to be the 4 pillars of the schedule. As far as like picking like a specific like time, like 9 o'clock, I don't recommend. The hospitals typically do that just for documentation purposes, but for at home use, morning, afternoon, evening, bedtime.
So like a 4 o'clock to a 9 o'clock change?
Oh, no. Even with like 12-hour medications, I tell people you have plus or minus 2 hours, of leeway. So if it's just take, let's say like Eliquis, like a blood thinner, like every 12 hours, you can take it 2 hours early or 2 hours later. It shouldn't make that big of a difference.
Okay.